Hi, my name is Paul Seal. I'm professor in the Department of Psychiatry in the Institute of Public and Preventive Health at Augusta University in Augusta, Georgia, USA. And today I'll be talking to you about the effects of a spiritually based character strengths curriculum on alcohol use in Zambian youth, a randomized controlled trial. I'm so sorry I can't share this with you in person in Victoria today, but I do thank you so much for viewing this recorded presentation. And if you're able, I invite you to interact with me via email or on WhatsApp, or actually also in person, almost, through Zoom at my Zoom channel from 2 to 3 p.m. on Thursday, November the 12th. I'd like to begin by acknowledging my co-authors and the study funders. My co-authors are Kristen Hatfield of Trinity College, Dublin, Dana Seal of Macon, Georgia, Global Resilience Oral Workshops, Yvonne Pandy and Troy Lewis, Deputy Director and Executive Director of Expanded Church Response, our NGO partner in Lusaka, Zambia, and my co-principal investigator, Dr. Sian Kim Harris of Boston Children's Hospital and Harvard Medical School. I'd like also to acknowledge our funders, the John Templeton Foundation and On Track Ministries, and point out that the opinions expressed in this presentation are those of the authors and do not necessarily reflect the views of the John Templeton Foundation. The authors have no conflicts of interest to report. This study was approved by the Institutional Review Board of Boston Children's Hospital and by Aries Converge, a human ethics board in Lusaka, Zambia. Previous studies from high-income countries have shown correlations of spirituality and resilience with reduced alcohol use. However, few studies have been done in low and middle income countries such as Zambia to explore these constructs. Our hypothesis was that providing character training through evidence-based spiritual practices and positive psychology interventions adapted to the context of a low or middle income country would raise resilience and lower alcohol use. The setting of the study was Lusaka, the capital of Zambia, where half the population is less than 15 years of age. Poverty rate is high, with 58 of adults reporting incomes of less than $1.90 per day. HIV prevalence is high at 12.3% of the adult population. And the population is quite diverse. There are over 70 languages spoken. English is the official state language and the language of education. The GROW Zambia study was conducted in English. The government is stable and supports the conduct of scientific research such as this project. And the most predominant religion in the country is Christian religion. 95% of adults are professing Catholic or Protestant Christians. You'll see in this diagram in the lower corner of the slide the geographic location of Zambia. It's located in the center of the southern half of sub-Saharan Africa and is bounded by 8 other Southern African nations. The study flow diagram demonstrates our study design of this randomized controlled trial. Initially, 25 schools were recruited from among ECR's network of faith-based organizations. However, 2 schools dropped out prior to start due to difficulty in meeting some of the study criteria. That left us with 23 schools, from which we recruited 28 groups of students of approximately 25 students each. These groups were then randomized to an initial start group and a delayed start group, and 15 of the groups in the initial start cohort, 349 students, and 13 groups in the delayed start cohort with 298 students. In July of 2018, a baseline assessment was administered, and after that, the GROW intervention was administered to students in the initial start groups. 7 months later, an initial second assessment was performed in February of 2019. Then the GROW intervention was conducted with the delayed start students, and the final assessment was conducted in October of 2019. This story depicts the curriculum components of Global Resilience Oral Workshops, which is a culturally adaptable storytelling curriculum. You'll see in the center of this slide that the core of the curriculum are the 24 values in action character strengths, which are taught through 24 Bible stories, with each story highlighting the character strength in the life of a Bible story role model. There are approximately 15 evidence-based positive psychology activities in each 90-minute GROW session. The session's conducted on a weekly basis. Students are involved in active constructive response as they encourage one another. They do singing and dancing together. They do dramas in which they act out, the students themselves act out the Bible story. There are several meditations related to forgiveness, gratitude, and mindfulness. In each session, students recite together a positive self-affirmation that says, God loves me, He has created me for His high purposes, and He will use my story to bring goodness, honor, and hope. There are prayers of gratitude, and also at the conclusion of the session, a prayer of benediction when one of the GROW leaders prays an individual blessing over each student. There are numerous games and interactive exercises designed to teach the character strength. And then at the conclusion of each GROW session, each student writes out their goal for how they will develop or practice the character strength during the week, and actually draws a small drawing or diagram of what that might look like. This is a picture from one of the GROW classrooms. We encourage them to post the character strengths on the wall. So you see here judgment, hope, zest, fairness, and honesty. Next to them are Bible verses, each character strength paired with a Bible verse. This one says, he who walks with the wise will become wise, but the companion of fools will suffer harm. We also have the definitions of the various character strengths. Now here's the definition of prudence: taking time to be careful before saying or doing something. As you can see in this photo, it's a joyful, energetic, positive curriculum. This is one of our GROW leaders leading in the song and dance portion of the curriculum, and the students behind her singing, dancing, and clapping. This table demonstrates the demographics of our student population. We have slightly higher proportion of girls than boys. About 55 to 6% of the group were girls. The mean age 11.4 years. Most of the students in grades 5 and 6, 45 to 50% in each of those two grades. Most of the schools were community schools. These are schools in low-income areas of Zambia that are actually organized at a grassroots level by the community for students who do not have the financial resources to attend government schools. The community raises the funds, builds the building, hires the teachers, and the students typically will attend the school in their neighborhood. 14% of the schools in this study were government schools. As I mentioned, the HIV epidemic has really taken its toll in Zambia, and lots of kids are unable to live in a two-parent home because one or both of their parents has passed away. 67% of our students in two-parent homes, 20% in one-parent homes, and 13% living with neither parent. In terms of measures of financial resources, we did ask how many rooms does your home have, and 37 to 40% stated their home had 3 rooms or less. How many ate 2 meals or less per day? That was between 10 and 16% of the students. There was religious affiliation reflecting that of the nation. Between 99 and 100% of the GROW participants professed Protestant, Christian, or Catholic religion. These are 2 of our students acting out or performing the active constructive response. They tell each other how they intend to practice the character strength during the week, and then their partner shakes their hand and says, I believe you can do it. So we measured alcohol consumption in this slide, particularly past 30-day alcohol use, using questions from the Global Student Health Survey. And you can see that at time 1, 12.2% of our initial start students and 14.4% of our delayed start students reported having consumed alcohol in the past 30 days. After the first round of intervention, you see that fell to 10% among the initial start students after GROW, but those that had not yet received the GROW intervention, numbers actually increased to 17.9%. At this point, GROW intervention was conducted with the delayed start students, and we saw their alcohol consumption drop to 11.2%, and interestingly, a continued drop among the initial start students down to about 4.2%. So differences between the initial start and the delayed start group. Adjusted relative risk ratio of 0.65 at the time 2 administration, and the adjusted relative risk ratio of 0.43 at time 3 administration. We also measured self-reported alcohol problems in the past 6 months, and you'll see that at time 3, when this questionnaire was applied, only 4.1% of the initial start students reported alcohol problems in the past 6 months, compared to 9.4% in the delayed start students, and that's an adjusted risk ratio of 0.40, a significant difference. Our conclusion then, that this spiritually based character strengths training shows promise as an alcohol prevention strategy for youth in sub-Saharan Africa. I would like to invite you to interact with me about this study. You can contact me via email at jseal@augusta.edu, through WhatsApp at +1 478 972 0972. And I certainly would love it if you would come into my Zoom room, my Zoom meeting room from 2 to 3 p.m. Thursday, November 12th. You can click here to join, or you can enter the meeting ID and the passcode listed here. Just a couple of shots of Lusaka, Zambia, and here our curriculum creator and master trainer, Dennis Seal. Thank you so much for your attention, and a good day.